Hello everyone. Here I will provide a point-wise friendly note formatted specifically for high-yield retention in the community medicine about the National Rural Health Mission. Um, Today I am going to this summarize and explain it point-wise manner. So first we observe the overview and the core objectives. So here I have highlighted the important points. You can read it and listen at first. After listening, you can read the topic and points from your Park textbook. This is taken from 28th edition of Park textbook. So this National Rural Health Mission was launched in uh, 5th April 2005. So initially for 7 years and then 2005 to 2012, but then it extended up to 2017. What is the core aim? The core aim is accessible, provide accessible, affordable, accountable, effective and reliable primary healthcare in the rural population. So it synergistic approaches about integrates about the health with the key determinants like nutrition, sanitation, hygiene, safe drinking water, mainstreaming, and then the what is the mainstreaming point is this program brings the Indian system of the medicine into the mainstream health delivery. So here see the point, it was specifically focused on only 18 states, that is the 8 empowered action group for states on the Bihar, Jharkhand, Madhya Pradesh, Chhattisgarh, Uttar Pradesh, Jharkhand, Odisha and Rajasthan, and 8 northeastern states, that is Assam, Arunachal Pradesh, Manipur, Meghalaya, Mizoram, Nagaland, Sikkim and Tripura, Himachal Pradesh, Jammu and Kashmir. Also I have mentioned that this it also brings the Indian system of the medicine, that is Ayush, to the mainstream healthcare system. So what is the main aim? The main aim of the NRHM is to provide accessible, affordable, accountable and effective and reliable primary health care, and bridging the gap in rural health care through the creations of a cadre of the accredited social health activity, that is ASHA. So these programs integrate with the NRHM and existing program of the health and family welfare, including RCS2. So this program is this acts as an instrument to integrate the multiple vertical health programs along with their funds with the at the district level. So this program integrate the programs includes these programs. These are reproductive and child health RCH2 program, revised national tuberculosis control program RNDCP program, national vector-borne disease control program, malaria, filaria, kala-azar, dengue, Japanese encephalitis. National Leprosy Eradication Program, National Program for Control of the Blindness, Iron Deficiency Disorder Control Program, and Integrated Disease Surveillance Program, that is IDSP. So what is the plan extension of this to strengthen this infrastructure? Here the park provided a picture and I have summarized this in a well manner. Look at this. The village at the primary at the village level the human resources feature is only one ASHA and one Anganwadi worker, AWW will stay. And what is the funds? That VHSNC. This VHSNC was found to provide some the drug kit and referral chains. The sub health centers SC, that is human resources will be 2 ANMs or upgraded educated HHP. What is the funds? Fund is United Funds of 10,000 per annum in 18 focus states and supplied with basic diagnostic tools, that is BP, hemoglobin and stethoscope. What is the primary health center's resources? Resources as the medical officers, MO, ICU doctors, 3 staff nurses, 1 LHB, and covers a cluster of SS. This funds are the target. This primary health center targets the 24 hours service in greater than or equal to 50% of the PHCs. So provisions for a second doctor, that is 1 male and 1 female based on the needs. And community health center, this community CHCs have usually 30 to 50 beds, including anesthetics for the first referral care. And what is the funds? Funds is from the operationalized as 24 hours first referral units, that is FRUs, and managed by the Rogi Kalyan Samiti. Here first, given this NRHM infrastructure, you can see this village levels ASHA, AWW and village health and sanitation committee. This is 1000 population. For 1000 population, we get 1 ASHA or AWW in every village, and the village health day, drug kit and referrals. This comes under the VHSNC. This VHSNC, that is the Village Health, Sanitation and Nutrition Committee, is an important tool to community empowerment and participations at the grassroots level. The VHSNC reflects the aspirations of the local community, especially the poor households and children by the year 2021. Then this comes after that level, village levels, that we come the sub health center level or AC level, that is 5 to 6 village. 5 to 6 village, we have 1 sub health center levels that have the skilled up, the graduation or educated RMPs or 2 ANMs, 1 male MPWs for 5 to 6 villages, and 1 telephone link, MCH or immunization days, drugs, MCH clinics. That is the Gram Panchayat level. And the third level comes for 30 to 40 villages, that is cluster of the Gram Panchayats. We have 1 PHC. That in 1 PHC we have 3 staff nurses, 1 LHV for 4 to 5 SHCs. We have the resources of the ambulance or hired vehicles, 6-day MCH, immunization clinics, telephone, 1 medical officer, Ayushman doctor, emergencies that can be handled by the nurses, that is 24/7, all 24 hours, and for 7 days, round the clock service and drugs, TB and malaria inserted tests. After that level, the tertiary level, that is the last levels of the rural programs, that is the CSC or the community health center. It is also known as the block level hospitals. This block level hospitals comes for per 1 lakh populations per 100 villages. That strengthens ambulance or transport service or increase ability of the nurses, provides the telephones, encourages the fixed day clinics. Here in CSC we have the ambulance, telephone, obstetric, surgical, medical emergencies for 24/7 and round the clock services. This is the infrastructure. So remember that this infrastructure, that is NRHM, have the district is the core unit of the planning and the budgeting and implementation. Village programs merge into this health district mission, and the state level into the state health mission. So here written in the part that there is the provision of the mobile medical unit in the district levels for improved outreach services. Then we come to the major initiatives under the NRHM. It is very high yielding cadres and schemes. That is the selection of the ASHA. One should remember that selection norm, one ASHA is for 1000 populations. For that is one ASHA per 1000 populations. So relaxed to one per habitations in tribal, hilly or desert area. It is so important that it's is the base of the community services of the healthcare system in India. So eligibility, what is the eligibility of female is the resident of the village, married, widowed or divorced, aged for 25 to 45 years with a formal education up to 8th class. This she must possess the strong communication skills and leadership qualities. So especially the age group is 25 to 45 years with formal education up to 8th class. Then we come to the Rogi Kalyan Samiti, that is a patient welfare committee or a hospital management society. This is a simple but effective management structure. This committee is a registered society whose members act as the trustees to manage the affairs of the hospital and are responsible for upkeep of the facilities and ensure the provision of the better facilities to the patients in the hospital. So in Ravi Kalyan Samiti, this is active across all district hospital days and sub-district hospital, SNH, community health centers, CHCs and private health centers, that is PHCs, till the June 2021. Then this comes about the village sanitation and nutrition committee. This empowerment and participation of the grassroots level. The VHC reflects the aspirations of the local community. This is not so important, but here comes the related health programs related to the MCH services. This mother and child health services comes in the Janani Suraksha Yojana JSY, Janani Shishu Suraksha Karyakram JSSK, and the mother and child tracking system, that is MCTS. So this will be discussed later in the other videos, but here know briefly that Janani Suraksha Yojana, it is a cash assistance schemes aimed at reducing the maternal and neonatal mortality by promoting the institutional deliveries in government health facilities. And then the second most important, the Janani Shishu Suraksha Karyakram. This was launched in 1st June 2011. This entitles all pregnant women delivering in the public institutions to absolutely free, zero expense deliveries. That is, it including the cesarean sections also, and free transport. This makes a shift to an entitlement-based approach. This makes a shift to an entitlement-based approach, and then the comes about the MCTs. That MCTs means the mother and the child tracking systems. So this is name-based digital web tracking for every pregnant woman and child up to 3 years to ensure the timely ANC, the institution deliveries, and PNCs and immunizations. This formed the linkages with the National Biometric Identification System, that is Aadhaar, in order to track the subsidies to the eligible women. Then the 5 new major new initiatives which comes this comes after 2011 to 2013. This year caps That comes first the Rashtriya Bal Swasthya Karyakram RBSK. So this RBSK is the initiative of the launched in February 2013. So this provides a child health screening and early intervention services through the early detection and management of the four, mainly for the 4Ds. 4Ds, these are the defects at birth, diseases, deficiencies, developmental delays, including the disability. About Rashtriya Kishor Swasthya Karyakram, that is RKSK. This RKSK, this is the new initiative launched in January 2014 to reach out about 253 million adolescents in the country in their own spaces and introduce this is a peer-led interventions in the community. So this shift focus beyond the sexual health to life skills, nutrition, non-communicable disease, and mental health and substance misuse. Then comes the National Iron Plus Initiative. So this initiative was initialized in 2013. This combats the iron deficiency anemias across the life cycle. This implements weekly iron and folic acid supplements, that is WIFS wipes, for adolescent aged, that is 10 to 19 years. Then the most vital important point, the RMNCH+A. This RMCH is the strategic continuum of care linking reproductive, maternal, newborn, child, and adolescent health stages. This strengthening the community to facilitate referral loops. Then comes the delivery points. This delivery points is the high performing health facilities benchmark and is specifically funded to provide the comprehensive RMNCH+A services. And around 27,000 health facilities have been identified as the delivery points for the focused support under the NRHM. Next is the digital health and universal coverage extensions. This comes the Kilkari, ANMOL, Ayushman Arogya Mandirs, and Ayushman Bhav campaigns. This Kilkari is an interactive voice response, that is IVR-based mobile services that delivers time-sensitive audio messages, voice call about the pregnancy and the child health directly to the mobile phones, to the pregnant women's mothers, to the young children and their families. So this mobile service delivering weekly for 2 minutes time sensitive audio messages about pregnancy and child care directly to the families from 4th month of pregnancy until the age child turns 1 year of age. Also, then the ANMOL, this is ANMOL. ANMOL is a tablet-based application which helps the ANM in carrying out their day-to-day work efficiently and effectively by entering and updating the services records beneficiaries on the real-time basis. Provides them to will readily available for information. It was launched on the 7th April 2016 and is operational in the 24 states or UTs. This being used by more than 97,883 ANMs since it was launched. So this is used for ANM only. And then the comprehensive primary health features, that is CPHCs, through the Ayushman Arogya Mandirs AAMS. This AAM or the Ayushman Arogya Mandirs formerly was known as Ayushman Bharat Health and Wellness Centers. This was launched in 2018. This moves the health delivery from the selective services to a comprehensive primary health care, that is CPHC framework, covering the prevention, promotion and ambulatory care. About Ayushman Bhav campaign. This Ayushman Bhav campaign was launched by the Honorable President in India on 13 September 2023. So Ayushman Bhav campaign is envisaged to saturate the selected healthcare services in every village or town in line with commitment by Honorable Prime Minister Narendra Modi to ensure reach to the last mile and enable access to the This Ayushman Bhav campaign actually launched in 13 September 2023 to saturate the health service down to the last mile. This includes the Ayushman Aapke Dwar 3.0 and the Ayushman Bhav. So, in Ayushman Aapke Dwar 3.0, this includes the achieving the Ayushman card saturations at the individual level, printing and distributing the Ayushman cards to the field level workers for further delivery, and launching a national-wide Ayushman card delivery campaign. The campaign almost involves the collaborations with health, panchayat raj and rural development, and seeking the support of the ASHA, frontline workers and self-help groups. And under this part of the Ayushman Bhav campaign, there comes the Ayushman Bhav. This Ayushman Bhav is the healthcare workers' health melas organized at the Ayushman Arogya Mandirs. So this is about the National Rural Health Mission NRHM. So review under the missions, we see the point wise. The overview and concept. This NRHM was launched in 5th April 2005. This core aim was accessible, affordable, accountable, effective and reliable primary health care to the rural population. Then horizontal integration of the vertical programs. The NRHM acts as the instrument to integrate multiple vertical health programs along with their funds at the district levels. Integrates the programs include this RCH program, RNDCP and many more. The infrastructure is the 4 levels or 4 tier infrastructure, that is village level, sub-center level, primary health care and community health care. The what is the main schemes for this NRHM? That is ASHA, Accredited Social Health Activist, Rogi Kalyan Samiti, RKS, Maternal and Child Health Schemes. So under maternal and child health schemes, we know the JSK, JSY, Janani Suraksha Yojana, and JSSK, Janani Shishu Suraksha Karyakram, MCTS, Mother and Child Tracking Systems. And major new initiatives, that is after latest updates, the Rashtriya Swasthya Karyakram RBSK, Rashtriya Kishor Swasthya Karyakram RKSK, National Iron Plus Initiative 2013, RMNCH+A Approach and delivery points. So now we are going to digitalize every health activities and subsidies. So we introduced the Kilkari app, ANMOL app, Ayushman Arogya Mandirs and Ayushman Bhav campaigns. Thank you.